The global pandemic of the novel COVID-19 disease sits heavily on our minds, and every day many of us find ourselves asking several questions about life moving forward, to which there are no easy answers. Animal health care needs continue even as other facets of life have come to a standstill. If your veterinary practice remains open for appointments, whether routine or emergency only, you likely find yourself asking, how can I protect my clients, teammates, and myself from contracting COVID-19? How can I continue to provide exceptional care to my patients? Though we still encounter unknowns every day, this video will provide up-to-date safety recommendations from reputable sources, alongside advice from AAHA members for how best to address these unprecedented circumstances. Please refer to the World Health Organization, the World Organization for Animal Health, the U.S. Centre for Disease Control, or the Public Health Agency of Canada if anything in this video contradicts current recommendations. On April 22, 2020, the CDC and the United States Department of Agriculture announced the first confirmed cases of COVID-19 in 2 pet cats in the United States. The cats live in different regions of New York State. They presented with mild respiratory illness, and doctors expect both to make full recoveries. One cat tested positive with no known human COVID-19 exposure in its home. The second cat's owner previously tested positive before the cat became ill. Preliminary studies indicate that cats are the most susceptible species, with the virus responsible for COVID-19 replicating throughout the upper and lower respiratory tract. Inoculated cats are able to transmit the disease to other cats. Younger cats show more severe clinical signs of disease, including death, while older cats are not as severely affected and recover sooner. Ferrets also seem susceptible to virus replication in the upper respiratory tract, but have shown no clinical signs. Scientists and government agencies continue to stress that no evidence suggests that cats are a major epidemiological cause of transmission of COVID-19 to humans. Instruct clients on proper pet safety measures if they or their pets get sick with respiratory signs. Explain that they should quarantine themselves not only from human housemates, but from pets as well. Keep pets indoors as much as possible. If they must go outside, keep them under close supervision on a leash, and do not allow them to contact other people or animals. Practice proper hygiene, including hand washing before and after handling or being around animals, and wear a mask if quarantine from pets is not possible. Discourage kissing pets, allowing pets to lick faces or hands, and sharing foods. Do not place a mask on a pet, as there is no sign this prevents infection and can cause unnecessary stress of the animal. Wear personal protective equipment when caring for a sick pet or a pet belonging to a person with COVID-19. Visit aaha.org/biosecurity and navigate to protocols in the side menu to view the proper sequence for putting on and taking off PPE. AAHA member advice. Close your entire practice to non-employees. Ask clients to wait in their cars while you and your teammates conduct exams and diagnostics. Have a technician or assistant take patient history over the phone, and then retrieve pets from the vehicles and bring them into the building. Call the owner after the exam to discuss findings and answer any questions. For accepting client payment, set up a secure online payment portal rather than taking payments over the phone. Use safety measures when retrieving pets from vehicles. Ask owners to place cats and smaller dogs in carriers before opening car doors. Carry 2 slip leashes out to the vehicle for retrieving larger dogs. For liability reasons, place both leashes on the dog rather than trusting the integrity of the owner's leash. Embrace telemedicine. As a first step, consider using it when the owner is waiting curbside for their pet and you are sharing your findings live from the exam room. Follow your state or provincial VMA to stay informed on using telemedicine when you have a current veterinarian client-patient relationship, or VCPR. You don't have a current VCPR. You have a current VCPR, but the pet has a new condition. Research telemedicine platforms to learn. Do they connect to your medical records? Can you collect payment directly from the platform? What is the fee for using it? And more. Join the Veterinary Telemedicine Community Facebook group for more information. We will include a link to the group in the About section of this video. Many practices are now only allowing clients in to participate in euthanasia. If you still allow clients into your practice with patients, restrict the number of individuals who may enter. Per the World Health Organization, maintain 6 feet of distance between you and all others. Change your appointment policy, limiting the number of people allowed in to 1 owner per visit. Consider using extension sets to increase the distance between you and the pet or caregiver. Visit AAHA Newsstat to learn more about how practices are handling euthanasia right now. We will include a link below this video. Close your lobby and public waiting areas. Provide ample spacing between appointments so you have exam rooms available for each arrival. Ask clients to call when they and their pets arrive and escort them directly to an exam room. Remember that the virus responsible for COVID-19 remains stable on many surfaces for hours or even days. According to the National Institute of Health, it is stable up to 24 hours on cardboard and for up to 2 to 3 days on plastics and stainless steel. Be mindful of all items with which you come in contact. Wear gloves whenever necessary for opening deliveries and disinfecting surfaces. Reusable masks and caps continue to align with AAHA mandatory standard MA41A.1. Disposable or reusable caps and masks that are laundered for each day's use. Continue to launder them daily. Save sterile masks for veterinarians and surgical settings. AAHA members have shared mask sewing patterns on the AAHA Accredited Members Facebook page. Here are some pictures of our members with their masks on. Per the American Hospital Association, elective surgeries are discouraged to conserve sterile gloves and gowns. Disinfecting exam gloves using hydrogen peroxide and peracetic acid, or autoclaving exam gloves, may be alternatives to sterile surgical gloves. COVID-19 safety. If a staff member is exhibiting symptoms of COVID-19, follow necessary precautions. Send the team member home to consult their physician. Alert the rest of your team to a possible exposure, but maintain confidentiality as required by law. Flexible sick leave is important. Example of precautions from the New York State Department of Health. If person A is confirmed to have COVID-19 and has worked closely with person B, who lives with person C, person A confirmed case, should be isolated. Person B, contact of confirmed case, should be isolated. Person C, contact of a contact, does not need to be isolated unless person B develops symptoms or tests positive for COVID-19. Wear a face mask as recommended by local authorities. Follow local recommendations on antigen or antibody testing for COVID-19 as they become available. Wash your hands frequently for at least 20 seconds using soap and warm water. Use an alcohol-based hand sanitizer. Cough and sneeze into tissues whenever you can, or into the crook of your elbow or upper arm. Socially distance yourself whenever possible. Remember the symptoms of COVID-19: fever, cough, and shortness of breath. According to the CDC, these symptoms may present within 2 to 14 days of exposure. Stay informed. Visit aaha.org/COVID-19 for news stat articles and regular updates on AAHA's response to the pandemic. Refer to the 2018 AAHA Infection Control, Prevention, and Biosecurity Guidelines at aaha.org/biosecurity. Before communicating new information, verify it on the website of the United States Center for Disease Control, the World Organization for Animal Health, the World Health Organization, or the Public Health Agency of Canada. The CDC has now created a page detailing interim infection prevention and control guidance for veterinary clinics during the COVID-19 response. See the link below this video and refer to it regularly. If you are an AAHA member, continue to adhere to our practice standards. Check for new advice on the AAHA Accredited Members page on Facebook. AAHA does its best to amend and correct misinformation shared on this page. However, please use your discretion in what advice you take and be cognizant of unsubstantiated rumors. Thank you for your time. We at AAHA wish the best of health to you, your teammates, your family, your friends, and of course, the pets whom we all love and care for.